What do Falcons do? They rise up. But today, guys, I'm not going to be talking about sports. I'm your host of RiseUpRXNs, Dr. Lee Denning, lifelong sports fan, the Golden Hard Doc. I have a video on that, which I basically put on the first video of my page if you guys want to know more about Golden Heart Syndrome and what it's been like living with that for me. But today I wanted to come to you and talk a little bit more about a medical topic that I think is truly important. Um, so I'll start really quick with my training. I'm a University of Georgia undergraduate, graduate with a biology and history degree. Loved history in high school, and I loved biology as well for medicine. Um, Wish you did not have to take all the plant science stuff in biology degree. I really wish there was a lot more for human sciences that you could take to get that degree. But it is what it is. Ended up finishing cum laude from UGA with both of those degrees and went on to the Philadelphia College of Osteopathic Medicine Georgia campus, which is in the Swanee, Georgia area. School that's probably, oh gosh, now probably a little over 20 years old, give or take a little bit. A sister campus of a school that's been around for about 130 years in the Philadelphia area, as the name states. Um, Osteopathic physician, I will be real honest, I do not use osteopathic manipulation really at all in my treatment, but I do still take the osteopathic approach of a more holistic approach to the body, understanding that we're not just treating one problem, we're trying to figure out the root cause and trying to address that. But something, and I did my residency in kind of the middle Georgia, Warner Robins area, but I wanted to take a moment to make a quick video because I was feeling led this morning. And I want to make this video about the idea that there are worse things than death. Oftentimes, I have patients and patients' families who are struggling with their own mortality. They're struggling with the consequences of poorly managed chronic conditions or with surprise conditions that, quite frankly, just come out of nowhere. Those are usually your cancers, particularly the rare cancers that pop up for no reason. Some of my smokers who have smoked 2 to 3 packs a day getting lung cancer, it's not surprising, but it's still incredibly emotional, and it's still an incredibly hard experience for them to go through. Same thing with my throat cancers, colon cancers, which we diagnosed a handful of people with, and then really rare things like lymphomas and leukemias. I don't know the rarest tumor that I've ever seen personally, but over the course of my medical school time, my residency, my personal career since then, which has spanned longer than both of those at this point, I've seen a lot. I have seen a lot of death, particularly when I was a resident. And this is something we as doctors, I think we struggle with sometimes. I, at times, have felt like I have lost my shock from death because it has been around me. Because when you're on nights at the hospital, and even when you're on days at the hospital as a resident, if a code happens, it's the whole hospital. You're going for everybody. You're not just going for your patients. I've run a lot of codes, some successful, but most, just like the numbers would suggest, unsuccessful. I'm going to be rambling a little bit in this video, but let me kind of start with coding. I think it is everybody's individual decision as to what they want to do with their lives. Should they, do you want to continue on? Do you want us to attempt to resuscitate you? I will say that shows like Grey's Anatomy or The Good Doctor or pretty much any of these romanticized shows, ER, go back, pick your favorite medical show, your favorite medical drama. Mine is Scrubs, and it's not because it's a drama, it's because, quite frankly, I felt like it was the most accurate representation, and it's still exaggerated, but it's the most accurate representation of what resident life and what hospital life really is, with the number of patients, the types of overwhelming things that get put on you. But what I want to talk about here is all of those shows do a horrible, god-awful job of trying to explain to the public what a code is. A code, from a medical standpoint, is when your heart stops beating and then we have to initiate advanced cardiac life support to try and save your life. This includes chest compressions, where we have to go at least 2 to 2.5 inches deep, which is about that deep into your chest. If you're sitting at your computer right now, I want you to just kind of put a little bit of pressure over your chest. Try and push it down in a little bit. And stop when you feel even the littlest inkling of pain. Usually it's somewhere around here. We have to go so much further than that. And what I tell people is coding is very unsuccessful in general. It's all we've got. We don't have a lot else. But you're not going to shock every rhythm. In fact, there's a lot of rhythms, cardiac rhythms or arrhythmias, that you don't shock. If we don't have a pulse and we have pulseless electrical activity, that's not shockable. All we can do is push medication and continue to press on your chest. Same thing with no rhythm whatsoever, asystole. We don't do shocks for that. There's no benefit to that. We just keep pushing medications like epinephrine and trying to get your heart back by pushing on it, pushing on your chest. Literally, the whole purpose of caving in your chest is so that we are literally pushing on all of the heart chambers mechanically and forcing blood through the body, and that's the whole purpose. And the reason we do it at about 100 to 120 beats a minute is that a normal heart rate is somewhere between 60 to 100, and we're having to do it in a very inefficient way, so we do it a little bit more. But I say this, codes are more successful in younger people. The numbers are still crap. It's still less than 20% for younger patients. When you get over the age of 65, that number drops significantly. And for every chronic condition you add, and for every year you add onto your life after 65, the numbers just get worse and worse and worse and worse for being successful and bringing you back. Now, with that said, we are successful and we do bring people back, and there are people who live very meaningful lives afterwards. But the likelihood that you code a second time within a 24-hour time frame if we're successful is greater than 50%. And then also the likelihood that you walk away with even a single rib that's not broken is very low. So every breath you take, if we get you back, is going to be agony for the next 6 to 8 weeks as your body heals. You will have to be intubated for at least a short period of time afterwards. And sometimes that leads to other complications. You can end up with permanent brain damage from your heart not working, your heart not pumping, because you can end up with what's called an anoxic or lack of oxygen brain injury. There are things that happen with the code, and again, it's not very successful. I don't know that I've ever had a successful code in anyone over the age of 85, which is why I often do recommend a DNR, do not resuscitate order, for my 80 and up population. And again, it's more because I don't want to have to violently rip you away from going to home, for what I would call going home, and then cause you to be in agony, and then likely cause you to be in agony for the last moments of your life. I don't want to torture patients in the last moments of their lives. That's not my goal. What I encourage everybody to do in terms of coding is I encourage everybody, especially if you're getting up there in years or you have some conditions that you know are going to eventually cause problems, while you're alive and while you're in relatively good health, go ahead and talk to family. Get your living will together. Get your durable power of attorney, durable medical power of attorney. We want to know exactly what your wishes are. Some of the worst cases I've ever seen in a coding situation were in 85 and up population, where their 60-year-old children run in the middle of the night, "Daddy, don't die, Daddy, don't die, it's not your time, it's not your time." This is in a guy that I remember very well had end-stage renal disease, on dialysis with pneumonia and influenza and congestive heart failure, to the point that his heart, when you looked at an echocardiogram later on, instead of beating nice like this, was basically doing that. This is a guy who had end-stage conditions, and his daughter is screaming for us to continue doing everything possible. And I knew that they had not had that conversation, that they had not talked about what he wanted, that they had not talked about end-of-life care. And I think that's very important. Contrast that with another person in residency who his family knew that he had chronic medical conditions. He was about 30 years younger, and unfortunately the guy we couldn't get him taken care of. He had congestive heart failure to the point very similar to this other gentleman. But eventually he got to a point where he coded. He was in a bad rhythm that was actually keeping him alive. He coded. We got him back because he was not a DNR, because he was young. And when we got him back, we had to put him on 5 pressor medications or 5 medications to raise his blood pressure. That's unprecedented. You don't usually have to do that. And families saw that it was a futile effort at that point, and they said, "Hey, we're at peace with this. We've talked to him. We know he doesn't want to go through this." So it was a very peaceful transition, and over the next basically 6 to 8 hours, he passed away afterwards with family surrounding him, and it was a very peaceful event overall. So again, I say that to say, family, talk to each other, get your plans on paper, let people know what you want done, especially if you're aging and especially if you have significant chronic medical conditions. It is worthwhile. It will save your family hassle down the line, and it will create less of a burden for them when that time does come for you to, in my loving words, go meet Jesus. I am a believer. I am a Christian. I don't talk about that really on this channel because that's not what this channel is for. It is a core belief or a core principle for me, though. So I do believe in heaven. I do believe that Jesus rose and died again. I do believe that. And I do believe that when we die, we go home. That, we're going home to heaven. So I don't necessarily see it as a bad thing when we die. It's a sad thing on earth, but it is not the worst thing in the world. And that was really the point of this video. I wanted to talk about the coding situation, and then I wanted to talk about the fact that there are significantly worse fates than death, in my opinion. There are some people, if you only believe that this life is what it is, and when you're gone, there's nothing. Well, death might be scary. I can certainly understand that. And death for you is a final moment, and you want to be alive as long as possible. I want to tell you that I respect that. I understand it. I don't agree with it, but I do understand it, and I hear where you're coming from. What I would say is that I have watched patients, and I've watched family members, and I continue to take care of patients with conditions like severe dementia, whether it be from Parkinson's disease or Alzheimer's dementia or Lewy body dementia or vascular or any type of dementia from stroke, which is usually related to vascular. You become not you. You become a soul trapped in a body that is decaying and that has no memory or has no ability to function in the way that you once upon a time did when you were probably thinking, yeah, I want to live as long as possible. You don't have that agency about you anymore. I watched my grandmother go through 12 years in a nursing home, and really I didn't watch that much. My mother did. My mother was there quite often. And my grandmother she was the oddity. She never got sick. She never had anything that got her. She broke, I think, her hips twice or her femur. She broke her lower body, I think 4 times over that time frame, had it repaired, and finally a stroke got her when she was 96 years old after 12 years in a nursing home because her mind had started going in her mid-70s. That was my first experience with dementia, and I have watched other patients and families go through it, and I have better ideas of what to tell them to expect now. But it's a hard thing to watch family members, and you just know that the person that you grew up with, that you loved, is trapped, that they can't do anything. Same thing for patients who have strokes, who end up on ventilators and who end up with feeding tubes or maybe not able to talk or not able to communicate. Basically, they have brain activity. We don't know how much because we can't talk to them and figure it out. But there's something there, but they're not still with us. I've had several patients over the years like that. I find that a fate worse than death, especially if you are in complete agency of your mind, but you can't even activate your body. You can't talk. You can't feed yourself. You never get to eat a sandwich again. You never get to have a drink again of any kind. Everything is done for you through a tube, and your breathing is done through a tube. I don't know what the purpose of life is at that point. And I say that with all love and sincerity. I don't know. For me, I would not want to go on that way. That seems terrible to me. I watch cancer patients who get eaten away over time by a disease process that we don't have a great way to treat, or by a rare variant where the normal treatments that are usually successful don't work, where we have to give you poison to the point that we kill healthy tissue. The whole purpose of chemotherapy is basically to kill the cancer without killing you. And that's a very fine line that I don't envy oncologists and hematologists for having to walk. They are amazing doctors. They are usually the best of the best in terms of academics and knowledge. And I don't envy their jobs at all. They have to deal with death on a scale that I have no desire to work with. But I say all this to say that I have seen a lot of shit. I have seen a lot of bad things. And then there are, oh my gosh, there are things that don't even make sense to me. One of the worst cases I ever saw was when I was a medical student. I really can't talk about it too much, but basically a 3-year-old with a metastatic cancer that ended up, I don't know the final result because I ended up leaving my rotation. I was done by the time she came in, but she was on ECMO. I'd never seen ECMO to that point. I hope to God I never see it again. ECMO is a terrifying device to keep you alive as a last-ditch effort. And I hope I never see that again. That was the most terrifying thing I have ever seen in my life. And I really have a heart for anybody who's gone through that or who's had family who have watched them go through that. It's a terrifying thing. Very terrifying thing. All that to say, guys, I mean this with all of my heart. I'm not being ugly. I'm not being mean to anybody. Everybody has to make a choice for themselves as to, do they want to continue to live with chronic medical conditions, or do they want to pursue a more palliative method of treatment? Do they want to let nature take its course? I tell this to every patient who's going through it. We are either all in treatment or we're all in palliative. If you try to straddle the fence, it pulls too many ways and you get pulled apart by it. So there are worse things than death. I think if something is treatable and we have a shot at getting done or getting you over it, then yeah, treatment makes a lot of sense. Let's stick with that. Let's go with it. Let's make sure that we're doing everything we can to try and maximize that effort. That includes doing every surgery, every chemo, every radiation, every tube that we need, at least for a short term, to try and get us better. But if the outcome is going to be we don't get to live the life that we've been living, we have no agency of ourselves anymore, we're fighting a futile battle, we're only buying a little bit of time, but we're still going to have to be on all of these machines to keep us alive, then maybe let's think about letting nature take its course. Let's think about letting us go home and go meet Jesus, go meet God. Let's think about that, because I think truly, in my heart of hearts, there are things that are worse than death in this world. I say that as somebody who's watched a lot of bad things. I say that as somebody who's seen miracles happen. But ultimately, I would say that it's everybody's individual decision what to do. But I would encourage you, if nothing else, especially as you get older, talk to your family. Do not let this be an issue that they have to deal with on your deathbed. Do not let this be an issue that they don't talk about for years, that you're just scared to talk about. Have the courage to talk about it with your family. Have the courage to get that living will, to get that durable medical power of attorney, to let the doctors know what you want done so that there is no confusion. With that in mind, guys, I don't have a lot else for you today. Thank you for watching. Thank you for liking, sharing, and subscribing. I know this is not my usual form of content. I know that this is a rather morbid video. This is a rather sad video. I appreciate all of you who have stayed to the end to watch this. I'm not sure when this is going to be coming out. I haven't made a determination. I just felt led to actually make this video today. But yeah, thank you guys for watching. And as always, rise up.